The language of medicine is a specialized vocabulary used by healthcare practitioners. Many current medical word elements originated as early as the 1st century BC, when Hippocrates practiced medicine. With advancements in medicine, new terms have evolved to reflect these innovations. For example, radiographic terms such as magnetic resonance imaging and ultrasound are now used to describe current diagnostic procedures. A medical word consists of some or all of the following elements, such as word root, combining form, suffix, and prefix. Learning medical terminology is much easier once you understand how word parts work together to form medical terms. The purpose of this video is to help you identify these elements in order to construct medical terms correctly. A word root is the foundation of a medical term and contains its primary meaning. In medical terminology, the word root usually, but not always, indicates the involved body part. For example, the word root meaning stomach is gaster. All medical terms have at least one word root. Most word roots are derived from Greek or Latin language. Thus, two different roots may have the same meaning. For example, the Greek word dermatos and the Latin word cutaneous both refer to the skin. As a general rule, Greek roots are used to build words that describe a disease, condition, treatment, or a diagnosis. Latin roots are used to build words that describe anatomical structures. Consequently, the Greek root dermat is used primarily in terms that describe a disease, condition, treatment, or a diagnosis of the skin. The Latin root cutaneous is used primarily to describe an anatomical structure.
And number two is combining form. Combining form is created when a word root is combined with the vowel. The vowel is usually an O, but sometimes it is an I. The combining vowel has no meaning of its own, but enables two word elements to be connected. For example, a combining form is written in text as abdomen in medical meaning abdomen. Append is appendix, small structure hanging from the largest structure. Larynx is a larynx, which is a voice box, muscle is muscle, thyroid is the thyroid gland. Three basic rules for building medical term. Rule number 1 is the word root links a suffix that begins with the vowel. Rule number 2 is the combining form links a suffix that begins with the consonant. Rule number 3 is the combining form links a root to another root to form a compound word. This rule holds true even if the next root begins with the vowel, as in osteoarthritis. Examples. The formula is root word plus combining vowel plus suffix. Here is the commonly used roots and combining forms. Dermat means skin, gaster means stomach, neuro is nerve, cardi means heart, pulmon is the lung. Dermat plus myositis creates dermatomyositis. Gaster plus tummy is gastrotomy. Neuro plus pathy is a neuropathy. Cardi plus teeth creates cardioteeth. Osteo plus malacia creates osteomalacia.
Thirdly, we'll be talking about suffix. Suffix usually but not always indicates the procedure, condition, disorder, or disease. In medical words, a suffix is added to the end of the word root or combining form to change its meaning. As we can see here, we have pulmonologist and pulmonology. Then both having the same combining form, pulmon, meaning lungs, but different suffix, ologist and ology. Ologist means the person who is an expert or a specialist in that specific field, while ology refers to a broader study of a science field. Another example here we have is the combining form gastro, meaning stomachs, and the suffix megaly, meaning enlargement, and itis, meaning inflammation. Gastromegaly is enlargement of the stomach. Gastritis is the inflammation of the stomach. Whenever you change the suffix, you change the meaning of the word. And it plays a crucial role in the medical terminology, helping with precision and clarity. As suffix provide specific medical terms, helping convey precise meaning. And they also help with diagnostic precision, often helping indicate size or condition, contributing to the precision of diagnostic terminology, helping the medical field.
The grammatical suffixes. The grammatical suffixes are attached to word roots to form parts of speech, such as adjective and nouns, or singular or plural forms of medical words. For example, cardiac refers to anything that related to the heart, and alveolus refers to tiny air sacs found in the lungs. The plural suffix. Many medical words have Greek or Latin origins and follow the rules of these languages in building and plural forms. When a word changes from a singular to a plural form, the suffix of the word changes. If the singular term ends in the suffix a, the plural is usually formed by changing the ending to E. For example, vertebrate changes to vertebrae. And if the singular term ends in the suffix x or x, the plural is usually formed by changing the ending isis. For example, appendix changes to appendices. The suffix types. The suffixes are grouped into surgical, diagnostic, pathological, related, as well as grammatical suffixes. For example, in surgical suffix, plasty means surgical repair, and in diagnostic suffix, graphy means process of recording. In pathological suffix, itis means inflammation.
Thirdly, we'll be talking about suffix.
Most medical words contain a root of combining form with the suffix. Some of them also contain prefixes. A prefix usually but not always indicates location, time, number, or status. A prefix is a word element located at the beginning of the word. So one prefix for another alters the meaning of the word. For example, in term macrocyte, macro is a prefix meaning large, cyte is a suffix meaning cell. A macrocyte is a large cell. By changing the prefix macro to micro, the meaning of the word changes. Learning the major types of prefix such as the prefix of position, number and measurement, and direction as well as some others will be help you master the medical terminology. Prefix of position describe a place or location. For example, meso means middle, meta means beyond, change, par means alongside, abnormal. Prefix of number and measurement describe an amount, size, or degree of involvement. For example, mono means one, uni means one, and bi or di means two. Prefix of direction indicate a pathway or route. For example, ab means away from, ad means toward, near, dia per trans means through.